folks, it's Kristina with Holy Road Pharmacy, and today we're going to go over a topic that I'm frequently asked about in the pharmacy, heartburn. Did you know that heartburn is actually a symptom and not a disease itself? It's often caused by diseases called dyspepsia and gastroesophageal reflux disease, or GERD. These two conditions are often hard to distinguish and it's beyond the scope of what we're going to do today, but their treatments do overlap. Both conditions have heartburn as well as acid reflux as a major symptom. This is often worsened by bending over, smoking, or eating a fatty meal. Before treating any condition with conventional medications, we try to see if there's a cause that we can identify and remedy. Check with your pharmacist to see if you're taking any medications or if you have any medical conditions that can cause or worsen heartburn. Some of these culprits include anti-inflammatories. This includes ibuprofen and naproxen. In some cases, we might look at discontinuing the drug, lowering the dose, or adding a stomach protectant if the drug is absolutely necessary. Some non-drug options you can try are cutting back on smoking, alcohol, or fatty meals that precipitate your heartburn. You can also try to avoid lying down right after a meal. Right now in Canada, there are three main classes of drugs that you can use to treat heartburn without a prescription. The first group we're going to talk about are antacids and alginates. Some notable examples of these are Tums and Gaviscon. These are used for mild and infrequent episodes of heartburn. You can take these as needed. Some pros with these medications are that they're relatively inexpensive and they come in many dosage forms such as liquids, chewables, and tablets. Some cons with these medications include that they're not great for prevention and that you can't really take them before a meal that you think is going to cause heartburn. Additionally, they have some gastrointestinal side effects. What I mean by that is some of them can cause constipation and diarrhea. The next group of medications is histamine type 2 receptor antagonists. You might know these as their more popular names, Zantac or ranitidine, and Pepcid or famotidine. These medications are great in that you can take them before you experience heartburn. You can use them for up to 2 weeks, once or twice daily, for prevention or treatment of heartburn. They're also relatively inexpensive. Some cons with these medications is that they don't work as well as the next class I'm going to talk about, and they're not always appropriate in certain populations, such as people over 65. The last group we're going to chat about are PPIs. In Canada, omeprazole is the only one that you can currently get without a prescription. Its brand name is Olex and it comes in a pack of a 2-week supply, which is what it's indicated for when you get it without a prescription. Pros with this medication include that it tends to work the best out of all the heartburn medications that we have over the counter. It's also well tolerated and can be used for prevention or treatment. A con with this product is that it's gained quite a bit of media attention lately because some studies are showing that with prolonged use there might be some increased risks, which include kidney failure and pneumonia. At low doses for short intervals, such as 2 weeks, this is not something that we're currently concerned about. One thing that I will mention is that all three classes have a variety of drug interactions which are class specific. If you're on any medications or you have any medical conditions, let your pharmacist know and we can help guide you to the most appropriate treatment. It's also important to keep in mind that some of these drugs in the classes interact with each other, so if you're thinking about trying a combination, it's best to speak with us as well. If you try any of these options for up to 2 weeks and your symptoms don't resolve, be sure to follow up with a doctor to investigate further. I hope this video has been helpful, and as always, thanks for watching.